Hi, my name is Paige and I'm taking care of patient Mr. Jones today. The doctor has ordered a IV insertion, and after reviewing his chart and his labs, his white blood cell count is elevated. So we're going to go ahead and get the antibiotics started. So first off, we need to prep for the basic IV insertion. So I'm going to go ahead, do some hand hygiene, and apply clean gloves. Alright, then I'm going to check the saline. We need to draw up 3 milliliters, and it is not expired, 7/17/17. I'm going to clean the top with alcohol prep. I'm going to get my 10 milliliter syringe prepared, put on a clean needle, draw up 3 milliliters of air. First I need to inject the air. Now I'm drawing up the 3 mils. Alright. Then I'm recapping the needle. Usually don't do this, but this goes in the sharps. Next I'm going to have to prime the IV INT tubing. Alright, and I'm going to unclamp it. Alright. Oops, sorry, I'm supposed to leave that on there. Alright, and then now I need to make sure that I have everything prepared and ready to go into Mr. Jones's room. I'm going to take these gloves off, and I'm going to go into his room.
Hi.
Hi, Mr. Jones, I'm Paige. I'm the nurse today. The doctor's ordered for you to have an IV. Do you know why you're getting it?
Yeah.
Alrighty. Have you had one before?
Yeah.
Which is your dominant arm, your right or your left?
Left.
Alrighty. Do you have a history of mastectomies, dialysis, shunts?
No.
Alrighty. So then I would go and perform more hand hygiene and put on some new gloves. I would then take an alcohol prep and observe for a new area. And do you have a history of any allergies?
No.
Can I get you to repeat your name and your date of birth?
Sam Jones, 9/2/2012.
Alrighty. Alright, and this looks like a good vein, so this is where I'm going to go ahead and start. I'm going to put on the tourniquet. About 4 to 6 inches above the site of insertion. I have a 20 gauge needle. Go ahead and open it. Alright. I'm going to go at a 15-degree angle, bevel up. I'm going to pull the skin taut. Alright, little pinch. I'm waiting to see flashback, and I do, so I'm going to release the tourniquet. I'm going to pull out the needle, and I'm going to leave the catheter in. The needle's going to go in the sharps container. Alright, and then I'm going to push the saline, or aspirate, I'm sorry. Alright, and I see blood return. I'm going to go ahead and push the saline. I'm going to clamp it. Discard of the syringe. Tape the excess, and I have a dressing that I would apply on top of the needle with my initials, the date, the gauge, size, and then I would go and I would document the time, date, insertion site, the size and the type of catheter, the number of attempts, and the client's response to the treatment. And Mr. Jones, can I ask you what your pain is on a scale of 1 to 10?
It's a 1.
Alright, do you need to go to the restroom?
No.
Alrighty, at this time I would lower his bed into the lowest position and put the side rails up and Tell him to have a nice day. And leave the call light by his bed.
Come in.
Hi, how are you? I'm Paige. I'm going to be your nurse today. How are you doing? How are you feeling?
I'm okay.
The doctor's ordered an NG tube for you. Have you ever had one before?
No.
Alrighty. We're just going to stick a little tube through your nose that's going to go through your stomach to do some suctioning. Can I get you to state your name?
Patty Jones,
Your birthday?
March 29th, 1985.
Alright. And are you allergic to anything, Miss Jones?
No.
Alrighty. I'm going to go ahead and raise your bed up and get you at a working level so it's going to be a lot easier. I'm going through and I'm checking the MAR against the patient's name and everything's correct. We're doing an NG tube. Alright, I'm going to go ahead and I'm going to place this towel on your chest. Get you a little bit comfortable. I'm going to go ahead and I'm going to test the patency of the nares. Alright, and the right one seems more patent, so that's the one that we're going to go ahead and use. Now I'm going to go ahead and I'm going to measure with the NG tube, starting at the tip of the nose, around the ear, and down to the xiphoid process. Then I'm going to go ahead and I'm going to mark it with a piece of tape. And before I get started, I'm going to set myself up and get some tape in place. Alright, then we're going to do some hand hygiene. First I'm going to check the back of the throat. Alright. Redo my hand hygiene, put on some clean gloves. Then I'm going to take the NG tube, dip it in some lubricant. Alright, Miss Jones. This might be a little bit uncomfortable, but we'll get through this together. Alright, go ahead. I'm going to start inserting this through your nostril. Alright, now I'm going to check to see that there's no coiling in the back of the throat. Alright, that looks good. Alright, Miss Jones, I'm going to ask you to take this water, and every time that I say sip, I'm going to have to push this further back into your nose, alright? Alright, and when I say sip, I'm going to push it, alright? Sip, 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 and sip. How are you feeling? Are you doing okay?
I'm okay.
Alright, good. What's your pain level right now?
It's a 2.
Alright. I'm going to go ahead and I'm going to just put this attached to your face for a second so I can check the placement of the tube, alright? Now I'm going to go ahead and I'm going to pull out some gastric acid, or secretions, pulling out 10 mils. Alright. I'm going to test it on the pH paper. Stomach contents are 4. Now I'm going to go ahead and inject 10 mils of an air bolus to make sure that the placement is correct, while listening in the left epigastric region. Simultaneously. Alright, and I heard a swooshing sound. Everything is in the correct place. Depending on patient policy, hospital policy, we would put it in, do an x-ray. Now I'm going to go ahead and I'm going to secure this to your face. Now I'm going to go ahead and, as the MAR says, attach it to low intermittent suction. And how are you feeling? Are you okay?
I'm okay.
Alright. I'm going to fasten this to your gown, just in case you need some slack. You can move your head freely. Alright. And I'll be back in about 2 hours to check the, to do some oral hygiene on you. and I'll probably be back in a few minutes to do an irrigation of your NG tube, okay? Are you in pain?
No.
Alright, and if you need to go potty, please use your call light. It's right here. Just in case you need anything, I'll be right here. Go ahead and lower you. Just let me know if you have any issues, you feel uncomfortable. I would lower the patient to the lowest position. And I would go and document the type of tube I used, which is the Salem sump, how long the tube was, the color of the gastric secretions, the pH of the stomach acid, as well as the patient tolerating the procedure well. And I would also monitor patient's intake and output.
Come in.
Hi, Ms. Jones. How are you doing?
I'm okay.
Alrighty, we're here to irrigate your NG tube. So I'm going to go ahead and pull you up. I'm also going to check the placement of your NG tube, alrighty?
Okay.
Go ahead and put the side rail down. Can I get you to state your name and date of birth?
Peggy Jones, February 17th, 1985.
And no new allergies, right?
No.
Alright. Now go ahead, perform hand hygiene. Put on clean gloves. I'm going to take the patient off of the low intermittent suction. Have a towel ready. And put the tube on the towel. I'm going to check Ms. Jones' back of the throat to make sure that there is no coiling. Next, I'm going to check the placement of the tube in the stomach. First, I'm going to withdraw some gastric secretion. And I'm going to auscultate and push the gastric secretion back while listening in the left epigastric region. And I hear a swooshing sound, which indicates that the tube is in the correct place. Next, I'm going to withdraw 30 mils of sterile water. And I am going to instill it through the NG tube. And then I'm going to withdraw all of its contents. Alright, how are you feeling, Miss Jones?
I'm okay.
Alrighty. I would then place the patient back onto the low intermittent suction. Remove the towel. I would then go to the computer and I would document how the patient tolerated the procedure, which she said was well. I would ask what her pain was on a scale of 0 to 10. I would record the volume of the contents that were withdrawn from her stomach, or NG tube, I'm sorry. I would then also document the color, the consistency of the contents, and I would then place the patient in the lowest position, remaining in a 30-degree semi-Fowler's position to lower her risk of aspiration. Miss Jones, do you need to use the restroom?
No.
Alrighty. Well, if you need to go potty, please let us know. Here's the call light so that we can continue to monitor your intake and output. Alrighty? I will be back in about 2 to 3 hours to perform some more oral hygiene.